My name's Joanne Williams. I'm the Making the Connections Officer at Bavo in Bridgend, and it's part of my role to work with third sector organisations to ensure that they're more engaged in the design and delivery of public services.
Making the Connections really does what it says on the tin. It's about making connections, getting the local CVC connected through to the local service board. That's been done across 15 councils in Wales, and we've invested nearly £3 million of the ESF funding in it. As part of that programme, we've appointed somebody in Bridgend, Bavo, and Joanne Williams has been working here as part of the project. Her works entail really close liaison with the local service board and others in the area. She's been quite successful in building up the ability of people to engage and participate more fully, to link all local organisations into the more strategic agenda of the local service board. She's helped set up some collaborations with the local health board, got people seconded in and people exchange between themselves and others, and overall has made the sort of impact we wanted the project to make. Through her work, they've been able to develop a number of organisations' abilities to engage with the public service providers in the area, to develop work on commissioning services and really build those connections between the community first, the voluntary organisations, the local authority, health board and everybody else involved with local service boards in the area. So all in all, the project has been a great success in delivering what it set out to do, making those connections and making them work for Bridgend.
Over the last 2.5 years, it's been part of my role to look at the design and delivery of public services and to work with third sector organisations to be more informed and engaged in the process. I've worked with public sector partners around procurement, tendering, commissioning, working with partners around collaboration, looking at consortia working, co-production and training for third sector organisations, but also bringing in public sector partners as well.
I've worked with the Making the Connections project twice this year. I've been on training courses that they've put on. It's given me different methods on how I can engage with different types of young adult carers and shown me different ways of how I can encourage them to participate in the group. The training that I've been on has given me the tools that I need to support the young adult carers effectively in having a say and a voice on local services, and I'll continue to use these tools in the future to carry out consultations with them.
We've worked very closely with Bavo along the years, but then Joe came to the Disabled Children Strategy Group, which is a multi-agency group of health, local authority, third sector groups that obviously support disabled children, and told us about the new role, and then we kept in contact ever since then. At the beginning of the project, we attended the Hear My Voice event, which was giving us all an opportunity to discuss the key priorities for the Bridgend area in terms of the single integrated plan. It's really helpful to be able to share ideas and opinions with other agencies rather than just fill in the consultation report cold. The project has also given us the opportunity to engage with more third sector and public sector organisations and to develop conversations with them, closer working links and better partnership working overall. Through the project, a third sector strategic reference group has been established, of which Abont is a member. The group is an overarching group that represents third sector locally in Bridgend. It gives us a voice to identify local issues and things that we feel are important, and to be that they can then be taken forward and addressed at a higher level or at a national level with the public sector. The benefit is that it gives us then other third sector groups will benefit from that in terms of improved, for example, co-production, procurement processes. Joe also helped us to engage with Wales Air Ambulance to learn from them and to develop and extend our fundraising strategy, and from that it was really helpful because we got lots of ideas around, for example, legacy fundraising, how to promote ourselves, how to make better use of social media. So that experience was really productive for us.
The Making Connections project has linked with the local service board in a number of ways. It's mainly been helping us connect with people more broadly, so there's been work to help us with the single integrated plan consultation. There's been work to bring other third sector representatives into the LSB structure and take part in discussions and meetings. and there's been work to raise awareness of the work of the LSB and the priorities of the LSB, which is helpful, because if third sector partners know what the LSB is trying to achieve, they can understand how best they can support that. The project has really helped the LSB to reach out to a different group of people that it wouldn't have done before. So the project has helped raise awareness of what the LSB is trying to achieve amongst the third sector. It's brought other third sector representatives into the LSB to work alongside agencies and services to help identify problems and solutions. So that's been really successful, and we're seeing benefits and outcomes from that as well. So a good example of that would be the work that the project's done in facilitating an agreement between the hospital and the carer centre, which is leading to reductions in readmissions. So a very practical example of coming out of the project.
I met through Making Connections when I came to a meeting 2 years ago, and we discussed the need for some support for people with homeless issues, drug and alcohol misuse, things that weren't normally targeted throughout the hospitals, and the need for carers to be supported in that situation.
I'm Judith Lewis. I'm a patient experience manager here in Princess of Wales Hospital. Part of my team are the PALs, which are Patient Advisory Liaison Support Officers. Being in the role now of patient experience and with the PALs, we've already identified how we can link in with them. I think it's a really key contact that we need. We come across lots of patients, relatives and carers, where now we know that we can point them in the right direction using the carer centre. We realise now what services are out there available to us that the PALs can use and link into. We meet patients, relatives and carers on a daily basis, and now we know that there is a point of contact out there. We will be linking in far more going forward.
I met Joanne through Bavo, where we've had a number of training and events, information events, which link us in with statutory services and public services to give carers the information and support that they need. So 18 months ago we had a meeting with Joanne and Gary Owen from the Health Board, where we discussed linking in with Princess of Wales Hospital and chatting and talking to staff, nurses, doctors, and raising awareness of carers' issues within the hospital. The importance of the project is to signpost carers when they come into the hospital or when their loved ones are discharged to services within the third sector. So we're able to signpost for benefits advice, legal advice, or other more specific advice from the third sector. So making those links are really important at key times. Never before we had that opportunity to link in with the hospital staff on a day-to-day basis and speak to doctors and nurses and get them to understand how important it is to support the carers and the families, especially at this key time in the carers' lives.
As a council, as an LSB, we recognise that in the long term, it's how do we come up with different ways of working amongst partners, and that includes working with the third sector. And a lot of the work that the project has looked at has been how do we start to build things together, how do we co-produce solutions rather than agencies deciding what the solutions are and just straightforward commissioning. There's a more sophisticated approach that we can bring by working together. So the project has facilitated those discussions by working with commissioners and people responsible for procurement in both health organisations and local authority, and brought them together with third sector providers to think about what are the barriers that stop that sort of co-production happening at the moment, and what are the sorts of solutions that we're going to need if we're really going to build innovative and sustainable solutions going forward. So I think the legacy of the project has to be the awareness, increased understanding that's been built amongst the services, amongst the agencies that work with the LSB, but also amongst parts of the third sector, and really recognition on both sides that different ways of working are required to work together, to collaborate if we're going to come up with solutions to the problems that our communities are facing. And that's a really powerful legacy.
There's a huge amount of work in terms of working with the community, voluntary and third sector, not just in terms of how we can take things forward, but this is around partnership approaches, local area coordination, the new Social Service and Wellbeing Act, which is coming into force is going to put a huge amount of emphasis on local authorities, work and health boards working towards supporting individuals, prevention and wellbeing agenda. The council can't do that alone. That's where we must start working with the community and voluntary organisations. We've been working with Bavo and Making the Connections project to look at co-production. We've attended some events around co-production which have been really positive. There's been a number of organisations across sector and we've had some open and frank and honest debates. I've actually done some soul searching both as a local authority but also as third sector organisations and partners about, well, what do we need to do, where are we at in Bridgend. I think it's fair to say we do some really good work in Bridgend, and I think Making the Connections has helped us identify actually there is some good stuff going on in Bridgend in terms of how we work with community voluntary organisations, how we work in a co-productive way.
The project's been really successful. I think there's been a lot of outcomes that have come out of it. I think there's been a lot more joined up working, a lot more people working together. It's built those relationships, it's connected people, and there's been particular outcomes that have come out of it that have actually had an impact and almost like a legacy for the project and for the CVC to build on going forward. I think being based within the CVC has been essential to the post. I think it's given me those links. I think the staff there, I've got a range of skills that I've been able to network and link them with public sector partners, which I think has been quite a focal point and of great importance for the post.
Partnerships are a key issue in the delivery of local services and understanding how those work. And part of Joanne's role was to really make sure that the right people were in the right place on the right partnerships. So she's greatly improved the connectivity between the third sector and the partnerships in the Bridgend area. Part of this role really does focus on making those connections between the different organisations, and delivering on that helps deliver a better collaborative outcome for all the people in Bridgend.